So I'm Dr. Nabors. I'm an orthopedic spine surgeon. I have been in the South Hills for 22 years, and I started at Mon Valley Hospital last summer. So I'm kind of new to this hospital, trying to get to know people, so giving a few talks. This talk is about back pain, and I'm going to talk about back pain in general, kind of an overview of all the different causes of back pain. And then by far the most common cause of back pain overall is disc degeneration. So first we have to kind of understand, get an idea of what the spine is made of so we can understand what hurts in it. And the three main components are the bones, which are the vertebrae, the discs, and the nerves which run down through the spinal canal. And next to each disc, a nerve comes out, which in the lower part of the back coalesce into the nerves that form mostly the sciatic nerve. And that's why when a nerve gets pinched here, it sends a signal down where the nerve goes, which a lot of people call sciatic nerve. There are muscles, of course, that are all around the spine, but as a significant cause of pain, they're actually minimal. Now, a lot of people think that muscles cause pain, but if and when muscles do cause pain in the back, it's usually a day or two, and it's usually minor. It's not the kind of pain that typically makes a person go to a doctor, have therapy, see a chiropractor, or have surgery. So of those three things, the first would be the vertebrae. And the vertebrae have kind of a complicated shape to them. There are different parts to them. There are all these different parts. The big part in the front is called the body, and that's what supports all of our weight. The hole in the middle is the spinal canal that the nerves run in. And then most of the other things are either part of the protective covering of the nerves or are places where the muscles attach. The bones do touch in two little spots in the back of the spine, and they're called facet joints, and those are something that can cause pain. They can become arthritic and cause pain. And then the disc is by far the main thing that causes pain for us. The disc, this is a cross section through a disc, and the disc is not just one solid thing like a washer or a piece of rubber. It has this thick outer elastic layer that's called the annulus. And inside of it is kind of a gooey, thick, putty material that's called the nucleus. And what this diagram is showing is that outer layer can get cracks or tears in it, and the red is supposed to be inflammation, which is what causes one of the things that can cause pain in our backs. And then the nerves are the last thing that can cause pain in our back. Now, they cause the most severe pain, and they don't just hurt on their own. They hurt if they're damaged or compressed by something else, typically pieces of disc or spurs. And this is kind of a detailed drawing of what the nerves in the lower part of the back look like. This word cauda equina, that's the Latin word for horse's tail. And the reason why it's called that is that the spinal cord, which is coming down here, it actually ends right here, and it turns into nerves that are floating in the spinal canal, filled with spinal fluid. And when it's cut open and you look at it, it kind of looks like a horse's tail. So that's why it's called a cauda equina. And then these nerves coalesce into the sciatic nerve, which goes down our leg. So again, back to the sources of pain: the bone, the disc, and the nerve. Another way to categorize what causes pain in our back is what the actual cause of the pain is, or what is being done to the bone, the disc, or the nerve. And these can be broken down into 4 categories. So really every painful condition in our back will fall into one of these categories: tumor, infection, injury, or degeneration. Now thankfully these two, which are the most severe, which are the two that could be life-threatening, are also the least common. So tumors of the spine, thankfully, tumors that arise in the spine are rare. Primary means that that's the place where the tumor started and spread from. Now, tumors that have spread to the spine that are called metastatic, they're actually the most common place for tumors to spread to bone. So, arm, leg, pelvis, the most common bone for cancer to spread to is the spine. And some of you may know people that was the first thing that made a person go to a doctor. Every once in a while, as a back doctor, somebody comes to see me because their back hurts. They have no idea they have cancer, and unfortunately, I end up having to make the diagnosis with an MRI. The reason why tumors cause pain is actually because they weaken the bone, and then the bone actually gets little tiny fractures or actually true fractures. And once a person gets a tumor in their spine, typically radiation is the most common thing to try to kill the tumor. Chemotherapy can also be used to kill the tumor. It's not usually quite as good as radiation. And then in rare cases where there's only one tumor in the spine and it hasn't spread to other places, sometimes it can actually be removed with surgery. Infection in the spine, it's rare, but it's of course a serious condition. It generally causes pain that just doesn't go away, unrelenting pain. It usually is associated with other things like weight loss, fever, just a general feeling of not being well. And the infection can affect the disc, it can affect the bone, or it can get into the area where the nerves are, the epidural space, and it can cause an abscess. Thankfully, most of the infections in the spine don't need to have surgery. They don't cause nerve damage, and they will be cured with 6 weeks of intravenous antibiotics. So now on to the more common causes of back pain, injury and degeneration. So injuries can kind of be subcategorized into these different things: fracture, strain, herniation, or muscle strain. So muscle strain, again, typically lasts a day or two. You overdo something and it goes away on its own. Disc herniation, picking up something heavy, falling. A strain typically refers to tearing of ligaments, and the outer part of the disc is made up of ligaments, and so if those get strained, that's what a back strain is. These typically cause pain that lasts anywhere from a few days to a few months, but will heal on their own. And then a fracture, again, can be kind of subcategorized as something called a compression fracture, a burst fracture. Little pieces called the transverse process can get broken off, and I'm going to go over each one of these individually. The most common kind of fracture is called a compression fracture, and that's what this diagram is showing. It's typically caused by osteoporosis, and there's a procedure called kyphoplasty in which a little tube can be put down into the compressed bone. A balloon actually can be inflated inside the vertebrae. It kind of creates a little pocket. It spreads the bones apart, and then bone cement can be injected into that, and it solidifies the fracture. A back strain, if we just kind of went with every person that ever hurts their back and goes to a doctor, this is going to be the most common cause of back pain. It can be very severe. It causes pain in the back, but no leg pain, so no sciatica. It's most commonly in the ages of 20 to 50, but it can certainly affect people older than that. And it's caused by tearing of that outer layer called the annulus. And typically it gets better on its own in 1 to 4 weeks. So this is a cross-section through a disc, and these little lines are supposed to be what the artist would think a strain looks like. So it's actually tearing of this layer, the outer layer. And because the disc is right next to the nerves, there are actually a lot of nerve endings that go to this, and so even an injury that would be relatively minor in another part of the body can be very painful in the spine. So then a herniation is a little bit different than a strain. It's kind of like a continuation of a strain in which this outer layer gets a crack that goes all the way through, and it allows some of this inner material to push out. And if it pushes in the wrong place, which unfortunately they often do, it will hit the nerve, and where that nerve goes, down the leg, is where we feel pain. So a herniation typically causes sciatica, pain running down the leg. Thankfully, 90% of them get better on their own. If we're lucky, they get better in a month. If we're not so lucky, they can take 6 months. The things we can do to try to make them feel better: anti-inflammatory medicine, Motrin, Advil, Aleve, Voltaren, Celebrex, Mobic. Physical therapy to try to help stretch things out, reduce inflammation, and sometimes an injection called an epidural injection to reduce inflammation on the nerves. Surgery is for the few people that don't get better with the other things, and it only removes the piece of disc that's pressing on the nerve. It can typically be done as an outpatient, and most people are healed within a month. And this is just another picture of what a herniation looks like. Inner part pushes through the outer part, hits the nerve. Degeneration of the disc, again, the most common cause of pain in our back. It can be subcategorized as degeneration of the disc, herniated disc, so this stands for herniated nucleus pulposus, and that's kind of the way you'll typically see it abbreviated in medical jargon. The back part of the spine where the joints, where the little bones touch, which is called the facet joint, that can get arthritis. And then kind of like the final thing that can happen to our back, and which happens to all of us when we get older. If we get old enough, we're all going to get this thing called stenosis, and I'm going to go through that. So if any of you have been to the doctor, had an MRI, you may have been diagnosed with degenerative disc disease. It's really not a disease, it's a consequence of the normal aging process. And it's probably due to a combination of genetics and either injuries or lifestyle. So what I mean by that is one person may live a very sedentary life, have a very non-stressful job, a sitting job all their life, but if they have bad genes, they may get a lot of degeneration. On the other hand, somebody that is a bricklayer and hurts his back a bunch of times but has really good genetics ends up not getting any degenerative disease. And then it could be any kind of combination of the two things. Some people have good genes, some people have bad genes, some people have a healthy lifestyle, some people have an unhealthy lifestyle. Everybody in this room looks like they're out of their 20s, so we all have an idea that when you look back on your life, you probably start aging when you're in your 20s. And so just like every other part of our body that ages, the disc starts aging in our 20s. When it starts to get to the point where it causes symptoms, it's usually kind of a stiffness and achiness, but it's usually not a debilitating kind of a pain. Again, it's part of the normal aging process. It starts in our 20s. The first thing that happens usually is that the outer layer of the disc gets a little tear in it. That leads to the inner part getting stressed. Dehydration, if you ever read anything about how and why discs wear out, that inner putty layer kind of dries out. And the combination of the annulus tearing and the dehydration of the nucleus is actually what the degeneration is. Now, why does our body not heal itself? Well, there actually is no blood supply that goes into the disc, so it's really not capable of repairing itself, and there are very few living cells in the disc. So it's not able to repair and regenerate itself like other parts of the body would be. This is a drawing of what degeneration looks like. So this disc is pretty normal. You can see it has a little bit of a spur there, but this is a very worn out disc where there's just almost bone on bone. Same thing here. And then this is an MRI showing a cross-section through a spine. These two discs are normal. The white inner part is that inner putty part, the black is that outer thick layer, and what happens is that inner layer dries out and becomes black on an MRI, and then if it continues to wear out, it will often bulge backwards. So that's what a bulging disc would look like. What can we do to try to prevent or treat the degeneration? Well, the anti-inflammatory medicine to reduce inflammation is kind of the simplest, easiest thing to do. People always ask, well, what can I do to keep my discs from wearing out? We don't have anything. We don't have an injection. We don't have a pill. It's kind of like everything else, like with our heart, our circulation, diabetes. A healthy lifestyle is really the best thing you can do, combined with aerobic exercise. Occasionally, somebody will have enough degeneration and enough symptoms that we do surgery, but that's rare. And this is showing what a very degenerated disc looks like. All the other ones are normal, and you can see how this one's really narrowed down, and this white is actually inflammation in the bone. So this is a kind of a person's MRI that has a lot of pain from disc degeneration, and sometimes we actually go in and scrape the disc out and fuse it together, and this is one of the devices that can be used to go in and fuse the bone together. If anybody is a golfer out there and follows Tiger Woods, this is pretty much what he had done, and it's allowed him to come back and start playing golf again. Facet arthritis, where the bones touch in the back, these little joints can become arthritic. This diagram is showing that there's a nerve that comes out of the spine and sends a whole bunch of nerve endings to these joints. And so they actually can cause a fair amount of pain. And if any of you have been to pain specialists, a lot of times pain specialists will diagnose people with facet arthritis, and they'll do these injections and things called rhizotomies to try to make the pain go away. And this is a diagram showing this thing is a facet joint. The bone above touches the bone below, and where they meet is this thing called the facet joint. And this is supposed to show what an arthritic facet joint looks like with all these bone spurs. And the nerves run right below these facet joints. So if they get enough arthritis and they get thick and produce bone spurs, they can actually dig into the nerve and cause sciatica. The symptoms of facet arthritis, usually low back pain that is lateralized, meaning one side or the other, not in the midline. Sometimes people think it's coming from the sacroiliac joint because it's low down and it's off to one side or the other. It usually is worse with extension, which is what this gentleman's doing. Leaning backwards usually makes it worse. And it's never debilitating. It's more of a nuisance kind of a pain. And the things that can be done for it, again, anti-inflammatory medicine. So this stands for non-steroidal anti-inflammatory drug. Aspirin, Motrin, Aleve. And then in some people, cortisone shots directly into the joint can help. And then there's this thing, this funny name called rhizotomy that sometimes can be done. And this is a diagram showing what a rhizotomy looks like. It actually is designed to burn the little nerve endings that come out of the spine and go to the joint, so that if the nerve that goes to the joint gets destroyed, now it can't send the nerve signal back up to our brain and we don't feel the pain. And this is going to be the last thing that we're going to talk about, which some of you in this room may have, which is spinal stenosis. It's narrowing of the spinal canal to the point where it's compressing nerves. Again, it's not a disease, it's the effect of the normal aging process of our discs. And it typically presents with symptoms as we get older in our 60s to 80s. So this is a cross-section through the spine. Here's the disc, and this blue circle is the spinal canal. And they're showing what the size of the spinal canal should look like. And then this is what this particular artist said they think stenosis looks like, which you can see how it's kind of like a weird shaped little oval as opposed to a big round circle. and it's caused by the disc pushing backwards. There's a ligament called the ligamentum flavum. It gets thicker, and then where the bones touch those facet joints, if they get thicker, they push inward. So it's really caused by three things: the disc pushing backwards, the ligament pushing forward, and then these facet joint spurs pushing forward. And this is an MRI of what stenosis looks like. This picture over here is the closest to normal that is up here. This is a cross-section through the spine. So we have bone, disc, bone, disc. The spinal canal goes from here to here. The white is spinal fluid, and that's a natural cushion. And then this gray is the actual nerve tissue. So the nerve tissue in the low part of the back really doesn't take up much space. And that's a little individual nerve, and that's an individual nerve. So there's a lot of extra room in the spinal canal. Now, these MRIs over here show what stenosis looks like. So again, there's the nerve tissue, and then you can see how it looks like a little hourglass. It's getting pinched there, and there, and there. And then this MRI over here, normal, normal, little bit of stenosis, and then severe stenosis here and here. The symptoms of stenosis: there's this thing called neurogenic claudication. Claudication means aching of legs, and it's caused by pressure on nerves. And it typically causes a pressure-like pain that often radiates down the legs. It usually feels better with sitting or leaning forward. And kind of the classic picture that we talk about as back doctors is when a person has to go through the grocery store leaning on a shopping cart without even seeing an MRI, without even talking to the person. Probably 95% chance that person has stenosis. What can be done for stenosis? Well, basically, you either live with it or you have surgery. You never have to have surgery. It never puts anybody in a wheelchair. It never paralyzes anybody. It causes pain. So if you can live with the pain, you live with it. If you can't live with the pain, then you talk to somebody like me about having surgery. Anti-inflammatory medicine, physical therapy, and cortisone shots. The surgery for stenosis is called a laminectomy, and it is the intention of it, the goal of it is to decompress the spinal canal, which is to alleviate the pressure on the nerves. This is showing stenosis. The disc in the front, it's pushing backwards, it's narrowing the spinal canal, and this is showing what a laminectomy looks like. The lamina is this part of the bone, so the central part of it can be removed, and it takes the pressure off of the nerves. And then this is showing what a laminectomy looks like if you kind of look down on the back of the spine. It basically is creating a window in the spine to take pressure off the nerves. And that's it.